What is bilirubin and how is it metabolised? Bilirubin is a byproduct of hemolysis, referring to the rupture or breakdown of the red blood cell. As the membrane of the red blood cell disintegrates, it releases hemoglobin into the bloodstream, which in turn releases heme. Heme is initially converted to a bile pigment called biliverdin by the enzyme heme oxygenase, and then this is further converted by another enzyme known as biliverdin reductase into unconjugated bilirubin. The problem with unconjugated bilirubin is that it cannot dissolve in water, and therefore it cannot be excreted from the body. Therefore, if unconjugated bilirubin is allowed to build up in the blood, it can deposit in the body's tissues, giving their skin, sclera and mucous membranes a yellow tinge. However, unconjugated bilirubin can also cross the blood-brain barrier and deposit in brain tissue. Usually this just causes a transient acute encephalopathy with sleepiness and poor feeding, but if severe it can cause staining of the white matter of the brain, resulting in an irreversible serious brain injury known as kernicterus. So the body needs to be able to change unconjugated bilirubin into a conjugated form, which is water-soluble and can be excreted. In order to start this process, unconjugated bilirubin binds to the bilirubin binding site on albumin, which carries it to the liver. At the liver, bilirubin unbinds from the albumin and enters the hepatocyte. Inside the hepatocyte, the unconjugated bilirubin binds to a protein known as ligandin, which stops the bilirubin from leaving the cell and transports it to the endoplasmic reticulum within the cell. Here it is conjugated with glucuronic acid by the UGT enzyme, which replaces the hydrogen bonds within unconjugated bilirubin, making it water-soluble. Once unconjugated, it can pass into the biocaniculi. Once inside the biocaniculi, it travels to the gallbladder to be stored as bile, and then will travel with bile to the intestine when bile is needed to break down fat. In the intestine, it is deconjugated by bacteria and converted into urobilinogen. About 80% of this urobilinogen will be converted by bacteria into stercobilin and will be excreted in feces. The remaining urobilinogen enters the enterohepatic circulation, where it is either excreted by the kidney or re-enters the portal system to be recycled.